Hi everyone, it's Audra Wolf here with Dr. Saravanan, who is a radiologist at ARA. She's going to talk to us about the importance of mammography and dispel some of the common myths that come along with breast cancer.
Hello, I'm Dr. Arthy Saravanan and I'm a breast imaging radiologist at Austin Radiologic Association. Today I'm happy to talk about the importance of screening mammograms and how it helps to detect breast cancer. 1 in 8 women will be diagnosed with breast cancer in their lifetime. The great news is that over 98% of these women are able to be surviving breast cancer early, and the reason for this is because of screening mammograms. The American College of Radiology recommends that women start getting screening mammograms at the age of 40 and yearly thereafter. Some women may be high risk. For instance, they may have a family history of breast cancer, and these women will need to start screening mammograms even earlier. I recommend that you speak with your doctor, who may need you to get additional testing for genetic factors, and you may qualify for getting annual MRIs as well. I'd like to talk about some myths that are pretty common in our patient population when I see them in clinics. The number one misconception that patients have is that they believe that if they don't feel a lump in their breast, then they don't need to get a mammogram. The truth is that with our 3D state-of-the-art technology known as tomosynthesis imaging, we're able to detect breast cancer very early, sometimes years before a lump is actually felt by the patient. Another common myth is that patients believe that if they don't have a family history of breast cancer, then they don't need to get a mammogram. However, the truth is that more than 75% of cancers that are detected in women actually have no known family history. These cancers are spontaneous, and that's why it's important to get a mammogram so that we can detect these cancers early on. Another myth is that patients believe that their breast tissue density actually defines their risk of breast cancer. So when you get a mammogram, we report in the letter that we provide to you, we report the breast tissue density of your breast in that letter. The breast tissue density is categorized into 4 criteria. Number 1 is almost entirely fatty. Number 2 is scattered fibroglandular tissue. Number 3 is heterogeneously dense tissue. And number 4 is extremely dense tissue. This just means that your breast tissue contains more glandular and connective tissue than fatty tissue. It doesn't necessarily mean that your risk for breast cancer is increased. It just means that it makes it a little bit harder for us to detect these cancers on mammogram. So sometimes we recommend adjunctive screening with either breast ultrasound or MRI to help detect these breast cancers. What's alarming is that many women in Austin over the age of 40 don't have their screening mammograms scheduled as yet. And this is easy to understand because, we do have busy lives, but it's very important to take care of your breast health. We have 13 locations across the city, very conveniently located, and it's easy to schedule your mammogram either online or by phone. The other good thing is that the insurance does cover screening mammography. I'm sure that you will understand the importance of getting a screening mammogram, and you'll be able to schedule your screening mammogram with us in the near future.
Thank you so much for your time. We appreciate your information, and below you're going to see resources to ARA on how to schedule your upcoming mammogram. Thanks so much.
Thank you.